Hello, Dr. William Berger here, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. And I'm dual boarded in internal medicine as well as obesity medicine. So today I want to talk to you about one of the pillars of lifestyle medicine, which is adequate sleep. Restful sleep. Sleep is truly foundational to everything else that we do to try to control weight and all of our metabolic parameters. This is because disturbance of sleep or lack of sleep, sleep deprivation, they all increase our fight or flight hormone, which is cortisol. This increases blood pressure, heart rate, as well as blood sugar. If you've ever been on prednisone, a synthetic steroid, then you might know about how it increases your blood sugar. This is all designed in the moment when you want to run away from a tiger to help you do so, give your muscles energy and make you alert and ready to go. But when this is a chronic issue, not so good. In fact, there are studies done with young military recruits, so young men, healthy, no medical problems, and they were sleep deprived down to 4 to 5 hours per night rather than 7 to 8 for 4 or 5 days. And by the end of that time period, their sugars had gone from normal to the pre-diabetic range. So even a small amount of sleep deprivation is negative for our metabolic health, essentially. And sleep deprivation might be, or lack of restful sleep could be from a variety of things. It could be because you're simply not getting enough hours. It could be due to caffeine consumption late in the day that's not giving you really good restful sleep. Sleep apnea, of course, which may be driven by weight and obesity, excess adiposity or fat mass, but also just may be anatomically how the patient is in terms of their airway at night. And so that needs to be addressed. Sleep apnea, because it puts that stress on the body, can make weight loss difficult and or actually cause weight gain. And drinking any alcohol before bed also disturbs sleep greatly, especially bad to try to put yourself to sleep with alcohol or to self-medicate any anxiety or other mental health problems that you might have. Most people, if they fall asleep that way, will wake up 3 to 4 hours later, so you're not going to get a good night's sleep by doing that. Of course, the things that we need to do are also lifestyle measures, barring treatment of sleep apnea and so forth, to try to get better sleep. So what we term this as sleep hygiene. So a dark room, a quiet room. Sometimes your partner in the bed might be snoring, and that's a problem for you. So kind of a tangential sleep apnea that needs to be dealt with. Or there could be a pet in the room. Of course, if it's a baby that's waking up in the night, well, they'll grow up eventually. But you need that kind of environment. But there are also ways to train your brain to help you sleep. One of those is to avoid working in the bed. That means not pulling out your laptop and doing, let's say you're a physician, charting on your patients or whatever kind of work you might need to do. Don't train your brain to think that the bed is a workplace. Let it only be a place for sleeping and so forth. And the same goes for any screen time before bed. So if you've ever seen video footage of another screen, you can see that it's a strobe light. And the strobe effect, as well as the wavelength of light that these screens emit, can tell your brain it's daytime, essentially, and that is going to make it harder to fall asleep and or give you less restful sleep. I am not a fan of using medications to help sleep. Sometimes melatonin can be useful. Melatonin is the natural product that our pineal gland at the base of the brain secretes late in the day in order to help regulate our sleep-wake cycles. So using a couple of milligrams, 5 or less, can be helpful. However, the use of melatonin is really to reset that circadian clock, and so it's a good treatment for jet lag, for example. You fly from one place to another into a different time zone. It's not typically all that effective for people dealing with any kind of insomnia. And speaking of treatment for chronic insomnia, the first-line treatment is actually cognitive behavioral therapy for insomnia, or CBTI, which is really a set number of sessions and exercises that a therapist can teach the patient, or if you don't have access to a therapist for whatever reason, it can be found online. You can get books and videos and so forth that'll try to teach you. It's not probably as effective as working with a person trained in CBTI. But the system is designed with a set number of sessions and particular exercises to essentially retrain your brain to go to bed at a decent hour and help you to get 7, 8 hours of restful sleep, because that's what most people need. Some people need a little less, some people need a little more, but when somebody tells me that, they sleep 3, 4 hours a night and they feel great and that's enough sleep for them, I really doubt it. And it's often borne out in their blood pressure, their heart rate, their blood sugar, their other metabolic parameters. So sleep really foundational for everything else. If we want to control our weight, it's really important, because the other thing that not getting restful sleep does is that it increases ghrelin, which is our hunger hormone. You can think of it like growling of the stomach, ghrelin. That's how I remembered, actually. And if we don't get very good sleep, you probably have experienced this, where you kind of have increased appetite. You crave for things that are probably not so healthy, sweet, salty, fatty, etc., junk foods, basically. And this, of course, is going to exacerbate any weight issues that you might already have. You're probably not going to be as interested in hitting the gym and working out if you didn't sleep well. It just kind of is a downward spiral, really. So the foundation for everything else that we're trying to do with diet, exercise, managing our stress, all of those things, underlying it is really, first and foremost, a good night's sleep. So what your mom used to tell you about getting to bed at a decent hour, at a regular hour, and getting 7 to 8 hours of sleep is truly correct. So listen to mom, listen to grandma, and get yourself a good 7 to 8 hours of restful sleep. If you would like to learn more about our concierge-style medicine program, where we address issues of lifestyle to try to help people get to a healthy weight and also maximize their metabolic health, then please give us a call, 516-604-41, or you can find us online at northeastmedicalpractice.com. You can learn more about other health optimization topics by tuning into my podcast, Longevity MD, on Spotify. And I just released a new episode that describes everything that we offer in our concierge-style practice. And spoiler alert, we offer a lot of excellent treatment to maximize health. Of course, everything that I share in these videos is for educational purposes only. If you have specific concerns or questions, please don't hesitate to reach out to your medical professionals, because we have not, in this environment, in the video, formed any kind of doctor-patient relationship. But until we meet again, be in good health.